to Borrelia. Okay, so just few words about the second tick-borne disease. Now we are talking about viral disease, which is caused by tick-borne encephalitis virus. Ladies and gentlemen, TB virus together with such virus like Japanese virus, yellow fever virus, or for example West Nile virus, belong to the group of RNA viruses which we call flaviviruses. The year that we talk about TB first, it was 1937. It was observed in eastern part of Russia, but the virus itself was isolated, but in Australia in 1956. Today we distinguish three different species of TBE. So we call them Western European virus, Eastern virus, and Siberian virus. Because TBE encephalitis is tick-borne disease, so we imagine that it's also transmitted by ticks. But I remember 2 years ago in Poland, in Institute of Countryside Medicine, sorry for translation, but something like that. It was a nice publication released that showed that this is not only one way of infection. So they tested, for example, the uncooked milk of cows, goat, or sheep, and as far as I remember, they detected RNA of the viruses in about 11% of uncooked milk. So probably ticks are not only one way of transmission. Here we can see the ticks that transmit the virus on every stage of its development. So it's the same situation like in case of Borrelia. One difference is that we are infected with Borrelia after some times when the tick is situation in our skin. So there are some publications that say that if you take out the tick up to 24 hours after being bitten, there is no risk you are infected with Borrelia. But here is opposite. The TB virus is transmitted at the time of being bitten. This is the epidemiology. So the most cases of TBE is observed in Russia. In Poland we observe about 300 cases a year. This is the graph of prevalence of brain encephalitis, every brain encephalitis. So you can see that in every year, the half of every cases in brain encephalitis is caused by tick-borne encephalitis. So this is a big problem, especially in Poland. We observe the seasonality. I think it was discussed in the presentation before me. So we observe most infectious cases in the second half of the year, especially in the summer and in the autumn. Saying about the clinical image, we can say that this is very interesting infection because sometimes we observe two stages. The first stage, which is very unspecific stage, people describe many flu-like syndromes and they think they have flu. They could go to the bed, take some anti-inflammatory drugs, and they started to feel better. And in some weeks, second step is observed with some neurological syndromes. I remember last year I met one lady in Poland that was infected with TBE, and she confirmed that. She told me that she was feeling bad, like flu, for example. She went to the bed, take some drugs. In some days she felt better, and she told me she cleaned the window in the whole building, and after 2 days she was taken to the hospital with neurological syndromes. So the syndromes are strictly connected with central nervous system, like irritability, changes in personality, sleepiness, ataxia, and many more. The mortality rate in our part of Europe is fortunately not too big. It's up to 2%, but in eastern parts, so caused by eastern virus, is up to 30%. The diagnostic. Unfortunately, there are no recommendations. When we were talking about Borrelia, I told you that USA, Germany, and Poland have official statements that describe the diagnostic. I don't know any recommendation in case of TBE. So every method can be divided into the same groups: direct method like PCR and indirect, like for example antibody detection. Disadvantages and advantages of these methods. So I remember, I remind that we have two stages of the disease. The first stage, which is unspecific, and what you can see that virus is detectable in the blood in the first stage. So this is the stage where the patient do not go to the doctor because they think they have flu, after some times when we have neurological symptoms, virus is not detectable in our blood. This is why very important role plays in serological methods. So IgM detection may be done in 10th day of infection, and IgG as well. So we produce two different techniques for TBE diagnostic. This is the immunofluorescence using cells infected with TBE virus. So here you can see the positive reaction. These shining cells are the cells infected with TBE virus. They are shining because antibodies are present. And we also can offer ELISA test in two different classes, IgM or IgG, and also the determination of antibodies in CSF. And our newest test is validated in Vienna units. I don't know if such methods are present in Lithuania. Vienna units are treated right now as the international units because they can be used for monitoring of our immune system, for example, after vaccination. So thank you for your attention once again. If you have any questions. Thank you very much.
Tai jeigu turim klausimų Patrikui, galim klausti, iš tikrųjų mes kažkaip išsiversim čia bendrom jėgom apie diagnostiką. Prašau.
Do we have numbers, for example, if we have ELISA, yes, and after that we do confirmation with Western blot? What is difference for like?
Actually, Borrelia was the main topic of my PhD studies in the past, so I did such measurement. So as far as I remember, in IgG, it was about, because I tested forest workers, people who work in forest. So for IgG, in ELISA, I observed about 60% of seropositive people. After confirmation test, it was about 40. So we saw 20% false positive result in ELISA. In IgM, it was lower, but it was about 20% of seropositive in ELISA, but we confirmed only half of them. So this is very, very important to do the confirmation test.